Kosha Buskate, and here I'm with Dr. Kruti Buskate, who is a homeopath based in Mumbai. She has been practicing over 19 years. So currently, as we know, the third wave of COVID is going on, and people are having mixed feelings about it. A lot of people have different ideas and confusions as to what we should know and what not. So today we are here to discuss the same, to have a conversation with Dr. Kruti about her experience in COVID cases. So, what has been your experience till now in COVID cases?
Well, if I can divide my experience into the three waves that we have been seeing. So naturally in the first wave it was altogether a different ballgame because the virus was new, nobody knew what is happening, and there was no vaccine also. So during that time, since homeopathy has this a system in which when there is a pandemic or when there is an epidemic also, we take a list of all the commonly seen symptoms and then we are able to find a drug, a medicine in homeopathy which can be administered to overcome those symptoms and hence the disease, the illness. This has been the history of homeopathy ever since it has been invented. So, sticking to that science, we could find a medicine which is in homeopathy called homeopathic prophylaxis. So, during the first wave, we were able to identify, we were also able to have some experience that remedies like arsenic, alb and camphor, which were given to largely most of the people who were having the positive infection, COVID infection during the first wave. And hence these medicines not only cured positive cases, but they were also administered to boost immunity in the first COVID wave. So in that sense, even there were other patients also who were tested positive, and they were given some tried and tested methods, and some trial and errors were also being done even on the allopathic by the allopathic counterpart. And they were given some antivirals and some allopathic medicines, a set of medicines by the allopathic doctors who were treating them. At the same time, when they were not recovering, such patients would come to us and we would be able to help them out even though the allopathic medicine was being administered. So that was our experience in the first wave. In certain cases which panicked and they did not want to go for allopathy, but they had this positive infection or the infections were moderate or mild or even asymptomatic. Such cases would also come to the homeopaths and particularly to my clinic also, and we were able to help them out with the specific medicine that we would find by taking into consideration their physical and their mental symptoms. So we were able to help many number of patients in the first wave. In the second wave, what happened was the disease would progress to the lower respiratory tract. As we all know, there were very many hospitalizations and there was just this SpO2, the oxygen levels going down. So we were able to also handle this situation very nicely if the correct homeopathic medicine was being prescribed to such patients. Now naturally, these patients, because their SpO2 would go down to maybe, one of my patients' SpO2 was 88 and he had to be hospitalized. Like after he was hospitalized, there was a call from his son that his oxygen level is not rising even with the oxygen cylinders that were being given to him. During that time, we could treat him using homeopathy. The allopathic medicines were also continued, but as soon as we began homeopathy, these oxygen levels started increasing and the use of the oxygen cylinder was, I think, completely stopped in about 1 or 2 days. So these kind of patients were also seen by not only me but by a lot of my colleagues all over the world. So homeopathy had very good scope during the second wave also. And we could minimize the hospital stay, or in severe cases, the oxygen cylinders were not anymore needed once started homeopathy. And we could also treat the families which were, as I said, mildly symptomatic or moderately symptomatic naturally. Plus, we were also administering the homeopathic booster or immunity booster medicines during that time. Now is the third wave. So naturally, the third wave is milder because it does not affect the lower respiratory tract, but there is a lot of variety of symptoms. So largely people present with joint pains, aches and body aches, and they are not able to recover their cough, which remains after COVID for a very long time, or they are not able to recover over their weaknesses, or they are not able to, just get back to their normal appetite or something like that. There have also been cases of vomiting and loose motions, especially in the pediatric age group. So all of these now homeopathy could help all of these definitely and for sure, even when they didn't want to go for allopathy, because in pediatric age group in cities like Bombay, it is a very well established fact that even the pediatricians and the well-informed parents, they do not want to go for things like antibiotics or antivirals or paracetamol just like that. So they do come to homeopathy and they are really, really well managed with the use of homeopathy. That's my experience.
Okay, that's great. That's really, really helpful. So, as you said that a lot of medicines, homeopathic medicines, were being prescribed for prophylaxis. So, currently, is there any change in the homeopathic medicines which are being prescribed for the same in the third wave?
Yes, there is some change. There is not single medicine that can be prescribed in the third wave because of the fact, like all these people are relating it to vaccines, that there is a change in the spike protein, which results into change in the different set of symptoms that are coming up. And hence, not a single medicine we can point to this time, but there are very different sets of medicine. But particularly for patients who are concerned about their immunity, especially when they have comorbidities, or these are elderly people, or these are very young children, then these people can get these immunity boosters by taking into consideration their individuality, their individual constitution. And in homeopathy, we call it as a constitutional medicine. So in COVID third wave, in my experience, the constitutional medicine, if prescribed, acts as the best immunity booster.
But are there even other general medicines which are being prescribed? Like a lot of them are like pretty general allergies.
Yes, I get what you are asking. So the medicines which have helped most of the patients this time, they can be also used for prevention in those families. For example, if I am prescribing a medicine which is called Rustox, which is given in cases which are positive with lots of aches and pains, and a lot of restlessness and high fever. Then in a family of 4, if one of the person is having this kind of symptom, I would prescribe him Rustox, and rest of the members who are not having any symptom at all, then I would prescribe the same medicine for rest of the family.
Okay.
But in the family where arsenicum album is being prescribed for one such patient who is having the strongest or he is the only positive person, and he is having a different set of symptoms where arsenicum album is indicated, where for example he is having a lot of severe dry cough or a lot of weakness and restlessness, body ache and body pain is not as prominent as that, and taking all the symptoms into consideration, arsenic album has to be prescribed to this person, then rest of the family members will be prescribed arsenic album. Then there has been, nobody is positive, there are people around who are positive and they are just concerned about that. Then naturally we'll have to speak about their concern and prescribe similarly.
Okay.
Yeah.
Right. Okay. So there are also a lot of patients who are allergic to certain allopathic medicines. They show up side effects and all that, and they don't want that. So a lot of them prefer homeopathy, or some people also in general like to prefer homeopathy. So can they completely rely on homeopathic medicine during COVID?
Yes, definitely. So that's what, at least in my practice, what I do is when the person himself is not insisting upon starting any other medicine apart from what I give in homeopathy, then I do not ask them to go for it. So definitely they recover only and only with homeopathy. Fully.
That's amazing. So since we're talking about recovery, a lot of people also have this common notion that it takes a lot of time for homeopathic medicines to work. A lot of my friends have told me that. And
yes. And they're skeptical about going for homeopathy.
Yes, because they're just, like,
that's a different class of
right.
people. Yes.
So, what do you have to say about that? How many days does it take to recover, especially from COVID?
How many days to recover from COVID depends completely upon the state of that person, the CT value, everything that any allopath would tell you or any physician would tell you. But the efficacy of the prescribed medicine is judged at least twice a day. So when I prescribe a medicine for somebody, for example, suffering from very high fever or suffering from a lot of vomiting or a lot of loose motion, then I see to it that within 6 to 8 hours the temperature starts getting controlled, or the symptom which is most bothersome starts coming under control. That is because I have seen the efficacy of homeopathy, and homeopathy medicine is expected to be that fast, right?
6 to 8 hours.
Yes.
Wow.
If we are talking only and only about the temperature, then it has to go down remarkably, right? From 103, if we are talking about 103 degree Fahrenheit, it should come down to at least 199 in about 6 to 8 hours.
Okay, that's great. That's great. And do you think there are any dangerous complications? Like sometimes you get a lot of post-COVID complications. So do you think they are there in the third wave, and how can homeopathy help with it?
No, they are not life-threatening complications found in the third wave, as far as my experience and my knowledge is concerned, because the virus is not affecting anything but from the upper respiratory tract. But there are irritating and annoying symptoms, as I already said, that there is a lot of irritating cough still going on 8 days, 10 days post-COVID. The reports are negative, still there is a cough going on, still there is a weakness, still there is a joint pain. So these are the complications if you want to consider them.
Okay. So I would like to ask this very hot burning question. A lot of people who are testing positive in this wave are vaccinated as well as unvaccinated. Of course, the ratios are different, but there is a mixed crowd. So, what is the role which vaccination is playing currently in this wave?
That's a tricky question. It's not my forte, but from what I understand, and as a doctor and as a person who's thoroughly understood medicine and the virus also, I would say that the virus has gone at least 30 variations in its spike protein, and there are more than 10 variations at the binding site of that virus, the receptor site that we say. So what happens is, the vaccine that was produced was a vaccine that was meant to address the virus which was prevailing during the time when the vaccine was manufactured, and now there is a variation. So there is some skepticism going around that the vaccine that we are currently using is not directly protecting against this virus. But I think if the vaccines are taken, then there is less suffering maybe, or there is less virulence. So some kind of, in a late term you can say there is some kind of protection.
Yeah.
There is some kind of protection. Nothing about the severity also, I would say, because the Omicron virus itself is less severe. So even in non-vaccinated people, not all non-vaccinated people had to be, they died or they had to be hospitalized. So the body's immunity is also playing a major role. It is able to control the Omicron also.
Okay. Do you think you can compare the vaccination to the medicines you are prescribing as a homeopath for the prevention of COVID?
I won't use the word prevention of COVID. I would just use the word immunity booster. Even vaccines cannot be said as preventives. They are also boosting immunity. Now, vaccines are boosting immunity by activating antibodies against the particular virus, which is the COVID virus, right? And homeopathy is boosting immunity by activating the entire immune system. So the antibodies, if you can say, there is a study made by Hafkin Institute against some of the homeopathic medicines that is being under trial, in which the interleukin-6 and CD4 counts were increased, which means the homeopathy is able to stimulate the innate immunity. So now you get a broad spectrum of protection against not only this virus but against everything.
Yes.
So I don't know how you compare a vaccine with homeopathy here. Maybe you can draw your own conclusion. To me, to my mind, vaccine is specific and homeopathy is general. General here does not mean that it will not protect against specific. General here means it is inclusive of everything around you.
Right. So it is an overall boost in immunity.
Yes, overall immunity booster.
Which will also affect your immunity,
which strengthens your innate, it stimulates your innate immunity.
To fight against COVID.
Yes.
Right. So thank you very much. I think this was very helpful to all of us over here, our audience.
And thank you for being a wonderful host, Rosha. We initiated this idea because we would have this conversation over our dining table, and because you are my daughter,
Yes.
and we would have and a prospective medical student, so we would have this conversation over dining table, and I'm so glad you came up with this idea of getting this conversation across to people.
Yeah.
And I really hope it helps a lot of people out there. So do not panic. We are all there to help you out in whichever way we go. Take care.
Thank you.